Good evening, everyone. This is Kazuo Derek from Group 9. We are looking at the assignment which was given to us, whereby we have a certain farmer of whom her sheep got a certain lameness in the right forelimb, and we are looking at how to see the causes, the diagnosis, and also getting the possible recommendations. Let's first look at the anatomy of this forelimb before we go any further. At the proximal end of the forelimb, it begins with the scapula, and the scapula at its proximal end, it doesn't have what we can call a joint. It is held in position by the muscles and the ligaments. And this is termed as, sometimes termed as syncytosis. Then at its distal end, it articulates with the humerus. Distal end articulates with the humerus to form scapulohumeral joint, which is a sphenoid joint. Then, the scapula of the sheep, it is kind of broader as compared to that of the goat, and also it has a less distinct operandi. From there, we can go to the humerus, whereby the humerus is a long bone. Secondly, when you look at the articulation of the humerus, we've seen that proximally the humerus articulates with the scapula, and then at the distal end, the humerus articulates with the ulna and also the radius. Then from that, you can go to the ulna and radius. If you look at the ulna and radius of the sheep, the radius is the one which bears most of the body weight, and the ulna is a bit reduced. And also partly joined together. Then between the two ulna and radius, there is a fibrous connection between the two. And then the ulna and radius, distally, they are going to articulate with the carpal bone. It's going to articulate with the carpal bone, forming radiocarpal joint, meaning from the ulna and radius, we are going to see that we are now going to the carpal bones, which appear to be in two rows. We have the proximal row on the top, and we have also the distal row on the bottom. The proximal, it is having 4 bones. These 4 bones, we have the intermediate bone. We have the ulnar bone. We also have the lateral bone. Then the distal row, we have the second and the third fused together, and the fourth with the second and third being fused arranged together to give us the pelvic. Then from there, we can move to we are saying that the carpal bone, now we've seen proximally it articulates with the radius, then at the distal end, it's going to articulate with the metacarpal bones. And the metacarpal bone, looking at the metacarpal bone of the sheep, we shall see that we have the third and the fourth metacarpal bones fused together to form a large bone, which is named as the canonic bone. That is the a large bond which is formed after the third and the fourth metacarpal bonds fused together. Then from there, we shall have the metacarpal bonds, or we can also add the fifth metacarpal bond is very small. Sometimes it may be absent. Then from there, we can go to the next part. Metacarpal bonds, distally, they articulate with the phalanges. And this happens at the fetlock joint. And this happens at the fetlock joint. Here, the phalanges, they are made up of two digits.
Hello class. Hello guys. Good evening. I'm called Ayuki Meka. I'm in group 9. And my question is, what is the pointing stand indicative of atomical? Which joint or structure is painful or affected? Here, the pointing stance, it's a condition where the animal is moving on the two limbs while the other is being suspended in front. The pointing stand is often a clinical indicator for sacroiliac joint pain, where a patient points to the area of maximum superior iliac spine. Anatomy of the pointing stance: we have joint, etc., sacroiliac joint. The location is where the sacrum connects to the iliac bone in the pelvis, which is the area indicated by the pointing stance. The significance: a patient pointing to the specific area with one finger, it's a strong clue that the sacroiliac joint is the source of their pain. And also we have the associated pain. We have pain location. The pain is usually felt in the lower back, the hip or groin, and it's often humiliating. Pain characteristic: patients with this sacroiliac joint pain may have difficulty with standing on the one leg. And then diagnostic confirmation: while the pointing stance, it's a good indicator, a diagnosis is confirmed with the physical examination, which may include provocation tests like a compression and a thigh thrust test. Thank you.
My name is Amelie Lucy, and I'm going to continue from where my colleague stopped. I'm going to present on the causes of poor limb. So the first cause is infectious causes. Under infectious causes, you can get foot rot and joint illness, which can also be called spastic arthritis. All this can be caused by bacterial infection. Then the second one is traumatic or mechanical cause. Under traumatic or mechanical cause, you can get osteoporosis and it causes the endosteophysis. Then the third one is nutritional. It causes, because of lack of vitamin, causes the deficiencies in that nutritional cause. The fourth one is developmental or conformational course. Here, the angle of the animal can get the injury and causes a lameness in it. That is the aim.
When is my name? So I'm going to discuss about why the sheep are more prone to the injuries than goats. Above here I've listed 5 major reasons. You can find out more. One of them is the body structure and the COG, which is the center of gravity. Now, if you look at the body structure of goats relatively have longer limbs compared to sheep with shorter limbs. And according to the mass distribution, on the sheep, the mass or the weight of the body is mainly distributed on the 4 limbs, whereas in goats have relatively low weights, smaller masses, and are evenly distributed all around. If you look at the hoof structure, you will find that can come close. In the hoof structure, I have some 2 templates here. We have sheep and goat. If you look at our structures here, theoretically they say that goats have more compact hooves, which are harder, and they have some sharper surfaces, sharper edges. However, if you look at the hoof of the sheep is more flat. If I could weight in it would be more of this size. It is more flat. Whereas you find that the hoof of a goat will be kind of smaller, and it is having sharper edges. That is for traction on the ground. Coming back to the point of body structure and center of gravity, if you look at the sheep, the ones with the shorter limbs, their center of gravity is low. Anything that is closer to the earth's surface, its center of gravity is low, whereas those objects or those particles that are far away from the earth's surface, their center of gravity is high. Therefore, a sheep is less prone to being toppling over compared to the goat. I'll move on to the third point, which is leg and joint flexibility. Naturally, goats are more agile compared to sheep. That's all I can tell you. And we can also based on the differences that you find in the joints. That is, we can look at the ligaments, the muscles, and the different fusion of bones in the sheep and the goat that bring about the differences in the flexibility. We find that goats are more flexible and are used to carrying out jumping and movement on rocky particles. If you move on to the fourth part, which is movement patterns, goats evolved from mountainous ranges. Those are rocky areas, and with evolution, they keep in some traits, some of which are
adaptability to rocky edges, and that makes them suitable for grazing on such rocky edges. If we move on to the last and a bit more sensitive, the fetlock angle in sheep and goats. The fetlock angle is located around somewhere here, near the hoof. The fetlock angle. Now they say that the fetlock angle in sheep is more slanting. Okay? Slanting, it's more steep. Steepness is the degree at which the surface is bent. Okay? I would say this is, I would have to say, let me draw for you 2 lines. This line is more steep than this one. So steepness in the fetlock angle of sheep. Their fetlock angle is around here. If you see that here, if I come and I merge it on this hoof I was drawing, the fetlock angle is more something like this. Then the hoof will, and the leg will continue. It is a bit slanting around here. Slanting. Whereas in goats, you find that it is more steep. It is upright, more upright. Okay? Creating the differences that you find there. Now, the significance of this, of the fetlock angle of goats being more steep, is that it gives goats more traction. That is, they are more stable on the ground. There is less chances of them getting injured. However, here, and comparing and adding on the fact that they have a lot of weight, there is a lot of stress being exerted on the fetlock angle, unlike in goats where most of the weight is straightly being opposite to the earth. Thank you.
Hello class. Hello guys. Good evening. I'm called Ayuki Meka. I'm in group 9. And my question is, what is the pointing stand indicative of atomical? Which joint or structure is painful or affected? Here, the pointing stance, it's a condition where the animal is moving on the two limbs while the other is being suspended in front. The pointing stand is often a clinical indicator for sacroiliac joint pain, where a patient points to the area of maximum superior iliac spine. Anatomy of the pointing stance: we have a joint, etc., sacroiliac joint. The location is where the sacrum connects to the iliac bone in the pelvis, which is the area indicated by the pointing stance. The significance: a patient pointing to the specific area with one finger, it's a strong clue that the sacroiliac joint is the source of their pain. And also we have the associated pain. We have pain location. The pain is usually felt in the lower back, the hip or groin, and it's often cumulative. Pain characteristic: patients with sacroiliac joint pain may have difficulty with standing on the one leg. And then diagnostic confirmation: while the pointing stance, it's a good indicator. A diagnosis is confirmed with the physical examination, which may include provocation tests like a compression and a thigh thrust test. Thank you.
This is Moro Augustine, member of Group 9. I am going to take you through comparative anatomy of the digital in cloven hoofed animals. So looking at the physiology and the pathology. In the comparative, we have homology, whereby we say homology is the 2 digits of the cloven hoof and similar to the third and fourth fingers of the human hands. Under the comparative still, we also have the structures. We are actually comparing the structures of the animal, whereby we say we looked at the digits, we looked at the hoof, interdigital space, the sole, and whereby from the digits we say cloven hoofed animals have 2 main digits in each foot, known as the outer, which is lateral, and the inner, which is medial. Which is medial close. We say from the hoof is harder, outer covering similar to human fingernails. We also look at the interdigital space, which is the space between the 2 claws, or the 2 claws. So we looked at the sole, which is the soft, flexible part that provides padding and also our grip. And this enhances animals, or gives animals what's called stability when they are moving. So we come to the physiology. In physiology, we looked at the traction, which is the combination of other outer shell and flexible inner pad for excellent grip. We also looked under pathology, under physiology, we also looked at the grasping mechanisms, which we said is a passive mechanism which allows the foot to grasp the rock by closing around. We also looked at the pathology now, which is the structural and which is hoof imbalances which arise from a poor conformation of the hooves. We also look at the negative palmar angle, which is where the heel angle is lower than the toe, and this is often associated with lameness. We also look at the long toe or low heel. It's where the sole of the foot is too close to the ground at the heel. We also looked at the damage, which is the sole bone can easily be damaged by a sharp object since it is soft. We also looked at the soft ground tissue, which is ideal for soft ground than other surface, which may predispose it to some damages, and also the laminitis. Thank you.
My name is Amelie Lucy, and I'm going to continue from where my colleague stopped. I'm going to present on the causes of four-limbed. So the first cause is infectious causes. Under infectious causes, you can get foot rot and joint illness, which can also be called psoriatic arthritis. All this can be caused by bacterial infection. Then the second one is traumatic or mechanical cause. Under traumatic or mechanical cause, you can get osteoporosis and it causes the endosteophysis. And the third one is nutritional. It causes because of lack of vitamin, causes the deficiencies in that nutritional cause. The fourth one is developmental or conformational cause. Here, the angle of the animal can get the injury and causes the lameness in it. That is the aim.
Everyone, I'm by the name Martin Cecilia, a member of Group 9. The question is, what is the pathophysiology of the sprain versus a joint infection? Yeah, to start with, I want to talk about the pathophysiology. Pathophysiology is basically the study of how disease or injury changes the normal function of the body. And then to start with, I want to start with what a sprain is. A sprain is the stretching or tearing of ligaments around the joint. So this is basically like when you stretch, where you stretch the joint, so it leads to tearing or wearing away of the ligament. Then also, when you talk about the joint infection is basically how pathogens are present, like the bacteria in the joints. So to start with, we just want to compare the two. To start with the sprain, if there is that excessive force or energy when stretching around those areas of the joint, it leads to tearing of the ligaments, and this leads to some changes, like we have the hemorrhage, we have the edema, we have the inflammation, and some pain around the joints will occur immediately that overstretching happens. And then there is also stability may occur. Yeah, stability will occur depending on the severity, how the thing has occurred, and after some time, that animal will start feeling that kind of pain. And then also we can go to the physiology of not physiology, but we go to the pathophysiology of the joint infection. As I said, a joint infection is all about the presence of pathogenic microorganisms around the joint. So here, the causes of the pathophysiology, we have the contagious spread. This is from the nearby infected animals through the contamination or maybe some, yeah, we have the pathogen through the contamination parts. Then we have the direct inoculation. That is happens through injury, surgery, and the injection. When you use this injection, whereby you share the one that is already infected with some pathogen, so it ends up spreading to the one that is healthy. Then also the homogeneous spread. This is basically from the blood stream, and this is through, yeah, as I said, this is through the bloodstream. Yeah, then when you talk about how it moves, this microorganism invades the synovial membrane. So that membrane around the joint, and it multiplies rapidly due to the blood supply. Because around there is that high blood supply, and then the neutrophil migrates to the joint. So the joint spreads, releasing enzymes and the cytokines. These mediators cause pus to form inside the joint, and we all know that when those microorganisms enter into the joint, and they enter to the joint because of some, let me say, they infect the joint, and then also they will overcome all those organisms that are there. So it will lead the joint to have some pus, and then also later the enzymes and the bacterial toxins, they destroy the cartilage and synovial tissue, leading to joint erosion, and if not treated, fusion of the joint may occur. And basically we say this question was telling us to compare the two. So we have a table. I could have only drawn it here. We have a table that is about the cause of the pathophysiology of the sprain, and then we have under this cause we have the mechanical trauma, and this mechanical trauma we have the stretching, we have falls, like when you overstretch, as I say, when you overstretch the joint, it leads to that the destruction of the ligament. Then also when you fall, it dislocates. Then under the primary tissue, we have under the primary tissue where it is affected, where the sprain is affected, it's the ligament. And the ligament helps us in providing stability. So, and when it is overstretched, it affects that area. And then we have the inflammation type. Under the inflammation type of a sprain, there is acute inflammatory response. And then we have the symptoms of the sprains. Under the symptoms of sprain, there is swelling, there is pain, there is limited motions, we have bruises that is seen. Yeah, you see the bruises out, and then inside you get maybe the ligament already dislocated. And then we have the exact point where the joint is damaged in the sprain. So where the joint is damaged, the sprain is what? It is the overstretch or the ligament tear. Then how do we overcome this problem? Or how do you let this sprain heal? This is through the fibroblast repair. So here the cell under the fibroblast repair, it produces the cells called the fibroblasts, and this fibroblast produce new collagen and elastin to heal and regenerate the tissue. So this is how it repairs. So when you talk about joint infection, we all know joint infection is caused by the pathogens like the bacteria, we have the fungal, and others. So here, it is caused by the microbial invasion. And then the primary tissue where it is really affected. And the primary tissue where it is really affected is the synovial membrane, that is, and the cartilage called the synovial fluid. And then the inflammation type, there is autoimmune, whereby under this autoimmune there is desmotic arthritis. Then we have infections like the septic arthritis. And on the onset of this infection, there is a rapid flow of infections or also injury. And then the symptoms of the infection, of the joint infection, we have severe pain, we have swelling, and there is also fever. So you find that animal really, the temperature increases, not as the normal one. And the area whereby the joint is damaged, it is due to the bacterial enzymes and the immune response. So here you talk about what exactly causes this. So this is due to the bacterial enzymes. Then when you talk about how this joint infection is, how can we treat this joint infection in an animal? This one requires the antibiotics. You all know that this one will be spray, and to avoid some pathogens like the bacteria to enter through. We all know these sprays. And then we have the draining. You have to drain the infected area or the infected joint. So I'll beg to end here. Thank you once again.
I'm going to discuss the topic that says how does the nutrition, calcium, phosphorus, and vitamin D affect bone growth and strength in young animals. So as my colleague has been talking about this comparison of the sheep and the goats, I'm basically talking about how nutrition affects the bone growth and the strength in ruminant animals. And the nutrition here we are talking about minerals like calcium, then we have phosphorus, and then we also have vitamin D. How do these minerals influence the growth of bones and strengthen them? Looking at the fact that young ruminant animals are always susceptible to deficiencies of these minerals. They have the deficiency of calcium, phosphorus, and vitamin D, especially if the pastures that these animals are being fed on are of poor quality, or if they are imbalanced. And the deficiency the deficiency of the pastures leads to impaired ossification. Remember from anatomy of bones, we say ossification is the process of bone formation through cells. So we realize that when our animals are fed on poor quality pastures that do not have enough calcium and phosphorus, will have impaired ossification. Impaired ossification. Sorry for my handwriting. Impaired ossification. There will also be softening of bones. There will also be stress, because actually there will also be limbo, mechanical stress. So this is the pathophysiological effect of the deficiency we realize from these nutrients. Our animals will have impaired calcification, softening of the bones, and then the limbo, mechanical stress. That will be further observed as a bilateral deformities, and sometimes we can observe them as unilateral deformities from our animals. We realize the limbs will be limping, they will be softened, and that all comes from the pastures, the point of the pastures that our animals feed on. So if the pasture content is poor or low, it goes back to affect the growth and the strength of the bone. Because I remember from the pastures is where the animals will get to the nutrients, especially we are looking at the calcium, phosphorus, and the vitamin nutrients. Thank you so much.
Joseph Charles Wawire, thanks for the presentation. I'm going to talk about best practices of hoof and small ruminants. Then after, I'm going to talk about economic impacts of lameness in sheep. I'm going to start with the best practices of hoof care and small ruminants. The first one is keeping dry areas where the small ruminants sleep and stay for the whole day. This one helps the hoofs to avoid the tear, the natural tear of the hoofs. Secondly, we have to do other practices like quarantine and maintenance. That one also will help to avoid overcrowding or introduction of infected hogs, infected ruminants to a new flock. We have another countermeasure, and that is a foot bath and foot bath and foot dips. This one also helps to remove the bacterial infections around the hoofs. That one will make the small ruminants very dry on the hoofs, and the bacterial infection will never enter to them. So we are moving to the next thing: economic impacts of lameness in the sheep. One of them is increased production costs. This is because we are going to take care of the infected hogs, and we are going to pay laborers. That this is labor and treatment costs, and also to replace the flock. That one falls under reduced productivity. Then we move to the next one. Then we move to the next one, reduced productivity. Infected small ruminants will not produce a lot of milk, and also they will not produce a high quality of meat. We move to the next one. We have also another impact, and that is the reduced quality of the fleas. This is the reduced when the wool is kept in a dirty place, it will not fit the favorable market for sale. I think that is all what I have for those two questions. Thank you.